Hello, I'm Dr. Richards. I'm the consultant who's been looking after your husband. And you're Mrs. Young and you've just arrived from America. Yeah, and you're John, his son, yeah. This is Jennifer, staff nurse, who I believe you've already met. Yeah. Thanks very much for coming in.
I'm just confused. He's worse. You've been treating him, but he's worse. I mean, we thought he would have improved by now.
I know he's developed pneumonia. We've been treating him with antibiotics and physiotherapy, but he still seems to be very poorly, and as you say, it does seem to be getting worse.
Why is that? We thought he'd improve with the antibiotics.
We had hopes that he would improve too, but unfortunately, despite everything we've been doing, including the antibiotics, he's actually getting worse.
Is there nothing else you can do?
We're doing everything we can at the moment, and despite all of that, he's getting worse. I think he's dying.
Surely not. He seemed fine a couple of days ago. I spoke with him on the phone earlier this week.
I know. He's had a severe stroke and he's got worse more quickly than we thought he would do.
Is there anything else you can give him?
We're giving antibiotics. Sometimes, very occasionally, patients with pneumonia are referred to the intensive care unit to be put on a breathing machine. But I think in your dad's case, because he's so poorly, that wouldn't help. It could just make him much more distressed and just prolong the dying process.
Surely there's a chance of him getting better.
I don't think so. I think he's dying.
But we were told he'd improve with the clot busting treatment.
I know, unfortunately it appears that he hasn't improved, and in fact now he's developed pneumonia, he's worse than he was.
But we still want him to be given a chance. I mean, why won't a breathing machine help him?
We know that patients who are severely ill with a stroke and pneumonia, that breathing machines don't help. It could just be a very distressing process for him, and it could actually prolong the dying process.
We'll keep him comfortable, we'll change his position and keep his mouth nice and moist. And if he becomes distressed, we'll give him some medication to make him feel calm.
Okay.
The other thing I wanted to talk to you is about the team's decision about cardiopulmonary resuscitation. Have you heard of that at all?
I've heard it.
Yeah.
I've seen it on the telly.
Yeah.
Where somebody's pushing hands down onto somebody.
That's right, yeah. What do you think about it?
If it works, it works.
Yeah. I think in your father's case, because he's so poorly, that we know that resuscitation wouldn't work. In people who are healthy beforehand, if their heart stops, then it's sometimes possible to restart, but when people become very poorly, resuscitation, CPR, doesn't work.
You're not going to resuscitate him then?
It wouldn't work. It may be that in the next few days, possibly sooner, his breathing and heart may stop. And we know in that situation that resuscitation wouldn't help. What we want to do is to make sure that he's kept comfortable. We need to document in the notes what the team's decision is, that we wouldn't resuscitate him, but it's important that we also make clear that there's a plan to ensure that he receives anything he needs if he becomes distressed or agitated.
He won't be in any pain, will
He won't, no, he won't. The nurses are very experienced in identifying when patients are in pain. I don't think he's in pain at the moment, but if we do suspect that, then we can give him medication to help with that.
You're going to keep going with the antibiotics?
Well, that's one option. Another option is to consider stopping them because they don't seem to be helping him at all.
But we want everything done. I mean, he's fit and strong.
I know, this is so difficult, isn't it? There's a balance. We don't want to be giving him treatments that are distressing him, but we can keep going with the antibiotics.
We feel that he needs intensive nursing. We'll keep him comfortable, we'll turn him and change his position, keep his mouth nice and moist. And if he gets agitated or we think he's in any pain, we'll give him some medication to keep him comfortable and calm.
Maybe you stop the antibiotics and are you going to keep going with them?
We can keep going with this course of antibiotics, perhaps see how he goes and see how he is tomorrow. I'd like to meet with you all tomorrow again, if I may. I'll come and find you on the ward. Is there something else you'd like to ask?
No, thanks.
Okay, well, I'll come and talk to you again tomorrow.
We'll speak again later today. You know, ask any questions at any time and stay whenever you want, but make sure that you all get some rest as well.